Asthma, the wheezing, scary moment when you can't catch your next breath. More than 20.4 million Americans over the age of 18 suffer from this chronic condition. It's our job as pharmacists to understand how to better serve these patients. Today, we're going to talk about one of the asthma measures seen in EQUIPP, medication management for people with asthma. Since asthma impacts nearly 8% of the adult population in the United States, you're likely going to come across this measure quite often in your pharmacy. So how do you make sure your patients are staying on their treatment plan and out of the emergency room? Look at your EQUIPP score. We identify patients from your pharmacy who have persistent asthma and calculate who is taking their medication as prescribed. EQUIPP considers several factors: health plan eligibility, age, medical claims data, and pharmacy data. For instance, asthma patients who have a Medicare plan need to be between the ages of 18 and 85. Those who have Medicaid need to be between the ages of 5 and 64. Once age and health plan eligibility are determined, we go as far back as the previous year to identify trips to the emergency room, confirm diagnoses, and make sure the patients are receiving their inhalers. We also exclude patients with certain conditions. So of those patients, who is taking their medication as prescribed? Check the person's adherence score using the proportion of days covered methodology. We're looking for patients who have their asthma control or medication on hand for at least 75% of the time. Research shows that when they do, they have fewer emergency room visits. Now that you know how this quality measure gets calculated in EQUIPP, you can periodically check your score and assess whether this population needs more of your attention. After all, you may be the only difference in that scary moment when a patient can't catch their next breath. If you need a refresher on how scores are calculated using the proportion of days covered methodology, check out our video on how adherence is calculated.